Good afternoon. I'd like to call to order the Tacoma-Pierce County Board of Health and Study session. Today is May 20th, 2026, and the time is 3:03 p.m. If the clerk could call the roll.
Board Chair Hitchen.
Here.
Vice Chair Bushnell.
Excused.
Board Member Herrera.
Excused.
Board Member Mello. Board Member Olson.
Here.
Board Member Ryasich.
Here.
Board Member Sadalge.
Here.
Board Member Yambe.
Here.
Alternate Board Member Cook. Alternate Board Member Ayala. Alternate Board Member Diaz. Alternate Board Member Merrick. Thank you, everyone. That completes roll call.
Thank you for joining us this afternoon. And by my math, we do have a quorum. We have two items of business on our agenda. One of them is a learning opportunity. We will actually be leaving the chambers and going on a tour towards the end, but just flagging that. So we are going to start with our first item, which is a septic system operations and maintenance. We've been talking a lot about septics recently in the last couple of months, so we're just going to continue that trend and learn a little bit about the reduced inspection frequency.
Good afternoon, Board Hitchen and members of the board. I'm Laurel Jellison. I'm the program manager for on-site septic and drinking water, and we have had a lot of discussions about septic lately. So today we are going to share how the new 3 to 5 year reduced inspection frequency program works, links to our strategic plan, and then Amy is going to give you an abbreviated version of what the class offers that we give to the public. I don't see I think she's working on getting the presentation up. There you go. So we're on the strategic plan slide. Perfect. Thank you. So the program helps us protect the community, the environment, and we've heard from a lot of community members that having an alternative to inspecting their system is really important. This is a process improvement that we've done in the department. We're looking at making things more efficient, giving homeowners another opportunity to reduce costs, maintain their system, and while we're still protecting the environment. So that's what we're going to be sharing today. Next slide, please. So you will see a map of Pierce County. This shows the septic systems that are on notification through the county. We started to work in sensitive areas throughout the county when we rolled out our operation and maintenance program. So that would be Key Peninsula, Lake Tapps, Spanaway Lake, some of the bigger areas. And we've expanded to, you can see on the map, all across the county. So it's not just in one area. We're really implementing this across the whole county. Next slide, please.
Before you leave that slide, and actually you don't need to go back, is Pierce County unique when it comes to the number of septic systems in urban areas in comparison to other jurisdictions, or is there a similar theme in Clark County and Yakima and King?
I think it's very similar across counties. Yeah.
Thanks.
So our reduced inspection frequency, again, we've heard from community members, this is a burden to them. It's expensive to maintain their septic systems. And so what we did is we successfully petitioned the Washington State Department of Health and asked for a waiver to increase the time between inspections. This is only for gravity systems, from 3 years to 5 years if they meet certain criteria. And so we're really proud to say that we're the first county in the state and the only actual local health jurisdiction that offers this option. Homeowners can take a class. They learn best practices, what to watch for, and there's some questions that they have to answer. And so when they do that, they can then have their next inspection date moved from every 3 years to every 5 years. So that gains them 2 years without having to do an inspection. They still have to be done by a professional, but that's a benefit. It basically gives them an extra 2 years, and it reduces their cost almost in half to actually do their own inspections. So providing education and guidance on maintaining their system, it empowers them to use best practices. It helps them extend the life of their system, which are very expensive to fix. You've probably heard us say before, the current system they have is the least expensive they're ever going to have. And so that's true. And we've had a really good feedback from participants in our classes so far. Next slide, please. So the eligibility requirements to get this reduced inspection frequency is that they have to have a gravity or pump to gravity system. They have to be a residential property, no rentals, and they have to reside in the house that they're applying for. It has to have a current inspection. So if it hasn't been constructed in the last year, they have to have a current good operation and maintenance inspection from a certified professional. And even if there were issues, as long as they fix them and there's no deficiencies, then they would qualify. The parcel can't have any kind of notice of compliance that they haven't, that's recorded on their title. And they can't have been approved with any kind of vertical separation, which is a technical term, but just sharing that. And then they can't be on a shoreline. So as defined by the Pierce County title, it can't be within 200 feet of a shoreline. Again, they're more susceptible to, if there's problems, to contaminate water. So that's a really important feature. And then once they take the class, they can apply for their waiver, and we've had really good success with that. The only reason that it might be revoked is if they don't have their next inspection done by a professional, or if they don't keep their system in sanitary condition and fix any deficiencies, we can roll it back to 3 years, or if the house sells. So that's the other thing, because then you'd have a new property owner, and if it's the same system, they have every opportunity to take the same class and apply for the extension. And so we do offer them that, but we do require the new owner walk through that. So what we've done so far, next slide, is we started this in September of 2025 was our first pilot project. We've held 7 classes so far, and actually technically we've held 8 because we had one last week. We've had good success with that. We've had 162 people apply. Of those, 129 were approved. So that's great. The 33 that didn't qualify has been normally because they didn't have a gravity or pump to gravity system. So it's some other kind of system, or they were too close to a shoreline or water. And so that's been the majority of reasons. The way that we notify people as we've rolled this out, so we already send notifications to people to remind them they need to inspect their systems. And so we incorporated this information into the letter we already had going out, just to say we've got a new opportunity for you, and it only goes to people that have gravity systems. And so then we let them know that there's a class available. They get that letter 2 months before their inspection is due. And so they have 2 months to get into a class. Of course, if they need a little extra time, we can give them an extension. So we work with them on that. But it's been really good, good for people, and really good feedback that they learned a lot. And so that's what you're going to experience today with Amy. She's going to walk you through, like I said, a very abbreviated, slimmed down class, and you get to see what the public experiences. So with that, I'm going to have to.
Let's just make sure nobody has any questions for you before we go into the class. So I just wanted to pause and see if anyone has questions around the program itself. And maybe it's just me has questions. So I have 2 around properties that are allowed to do this. So you said no rentals.
Mm-hmm.
Does that capture short-term rentals? So if they are running a short-term rental out of their home, or is it more the owner occupied? Because a lot of short-term rentals are owned and operated by somebody who lives there maybe during the week, but on the weekend they rent it out, or they're renting out a portion of their house.
So we were just having this discussion actually in the office. What the waiver that we requested from the Department of Health says it has to be owner occupied, no rental. We hadn't had a situation until today that came up, so we're actually discussing that because we had a situation where it's a duplex and they live there, but they rent the other side. And our first thought is the reason we built that into the waiver in the first place is because when you come to the class, you know best practices, you know how to use your system. If you're renting it out, other people are coming to that, they may not treat it the same way. They may not follow best practices and you don't have any control over that. So we really were focused on people that reside there, full-time resident and not rental. But we're going to be discussing when it's two sides. So we'll have to get back to you on kind of where we land. But the intent of the waiver, and we'll have to touch base with the Department of Health also, just to say the intent and what we put in there was you reside there full-time.
Okay, because we also have like mother-in-law apartments or
Mhm.
ADUs that also share the same septic system, but you have multiple users. So I was just kind of curious where that fell with rentals. The second one is if somebody's running a business out of their home. We have home-based businesses that happen in residential areas, especially in unincorporated Pierce County, garages, childcares, that all of these things, would they get captured because it's their home and they're there?
So this is residential, not non-commercial. So it would be considered commercial.
Thank you.
Absolutely.
Okay, well, let's learn how to manage a septic system.
There you go.
We don't have to go dig one up, do we?
No, but that would be kind of interesting. Another field trip? I'm just kidding. No. Good afternoon, members of the board. My name is Amy Pearl. I work in our operation and maintenance program as an environmental health specialist. And I'm here today to kind of go over the slimmed down version, like Laurel said, of the class that we put on every 2 months right now to homeowners in our county. I would like to kind of start off with and just get a raise of hands of how many folks have either are on a septic system right now, have been on a septic system, know somebody that's been on a septic system. Okay, so quite a few of you. Great. Well, this is going to be great information for you guys just to know in general, and maybe even tell your family members if that's somebody that you know. Next slide, please. So our agenda today. So we're going to review septic system overview. We're going to go into how to look up and read a record drawing and or as-built is what we call it. We're going to look into best practices for your septic system. We're going to look at things to look out for and then cost of poor maintenance. And then we'll look into the next steps. Next slide. So septic system overview. So what is a septic system? A septic system is a small scale wastewater treatment system. It uses soil as the final treatment. And once effluent is treated, it returns to the groundwater. Here you can kind of see in this cross-section photo, it shows how the effluent is going from the septic system down through the soil to be treated and then into our groundwater. Again, a natural resource. Next slide. So the first short video will provide information on the basics of on-site septic systems. So enjoy.
Hi there, welcome to Septics 101. In this video, we're going to cover the basics of sewage and on-site septic systems. In the past, sewage was not treated, and the outhouses or cesspools that were used did not effectively remove pathogens, which are harmful disease-causing organisms. Bacteria, viruses, protozoa, and worms can all be present in domestic wastewater and septic systems, and can cause diseases such as hepatitis, cholera, diarrhea, and other gastrointestinal illnesses. In modern times, rules and regulations have been established on how to properly dispose of sewage. When not connected to a wastewater treatment facility or sewer, a home's best long-term option is a septic system. Clearly, it's important to make sure your septic system works properly. But first, you need to know how your system works. In this video, we'll look at sewage and its potential impacts on health and the environment, and we'll explore the different types of septic systems and how they work. We'll also talk about being a responsible septic system owner and how to care properly for a system, as well as how to detect a system failure and get help. This is all to maintain the health of your household, for you and for your family, and protect the water quality, as well as save you money. If you're completing this course for a certification program, there will be an exam at the end of the presentation. If you're looking to install a septic system, looking to purchase a home with a septic system, or simply wondering about your existing system, this video is for you. So what is sewage anyway? Sewage is all the wastewater that comes from your house, your toilet, your dishwasher and washing machine, sink and shower drains, and all the solids and waste that comes with it. Up to 50% of domestic sewage is created by your clothes washer and toilet. Your dishwasher produces 3%, while your bath, shower, and sink faucets produce the remaining percentage. All this wastewater exits your house and enters your septic system. By the way, rainwater, surface water, and groundwater are not considered sewage.
Next slide. Next slide. Perfect. I know it's a little touchy with the videos. All right, so you guys thought your participation was over at the very beginning. Nope, just kidding. So question 1, what is a septic system? Choose all that apply. Once you know your answer, I'm going to go through the list of them. Please raise your hand. A type of water treatment plant. B, a small-scale wastewater treatment system. C, a drainage system for rainwater. D, a public sewer system. How many of us chose A? B, C, or D? Next slide. B, a small-scale wastewater treatment system. Good job, folks. All right. In our next video, we will be learning about best management practices for your septic.
Septic systems need regular maintenance, just like your car or your home. First of all, know where all the components of your system are located on your property. An as-built or record drawing is a technical diagram of your septic system. Check with your local health department to obtain a copy of your as-built. The record drawing can tell you what type of system you have, where the components are located on your property, and provide other useful information. Record drawings are not always accurate, so make sure you verify it's correct. If you need to have your system located, make sure you also know the location of all utilities. Depending on the type of system, you'll want to know the location of your septic tank, pump tank, sand filter, distribution box, and drain field. Let's talk about what you can do to protect and care for your system on a daily basis. Garbage disposals grind up unprocessed food into fine particles, which can clog components of your system, like pumps or even drain field pipes and soil. Use it sparingly. An alternative is to compost. Make sure you have an outlet baffle screen installed to help protect the drain field. Doing your laundry has a big impact on your septic system as well. Space out your laundry loads to allow your septic tank to settle properly. If water flows too rapidly through the septic tank, solid material will not separate and could move on to more sensitive parts of the system. Limit the use of bleach. Bleach kills the helpful microbes which treat the wastewater. Liquid fabric softener can seriously alter the chemistry within the septic tank, hindering proper treatment. Installing high-efficiency washers and toilets can increase your septic system's life and save you money. Do not throw garbage into your toilets or feminine products and wipes of any kind, even those that are flushable. Kitty litter and pet waste of any kind should never go into your septic system. Some cleaning products claim to be safe for septic systems. This may or may not be accurate. Look for cleaning products which use everyday ingredients such as vinegar and baking soda. If you do use strong cleaning products, just use less. Never put paint, thinners, or strong chemicals of any kind down your drains. Many areas have disposal services for dangerous or toxic material. To dispose of unused medicine, bag it up and throw it in the garbage. Check with your local health department or pharmacy to find out whether a drug take-back program is available in your area. Do not drain hot tubs and water softeners into your septic system. There's no need to waste your money on septic additives. Just use your septic system properly. Let's talk about how to protect your drain field. It's critical to protect your drain field and reserve area. The reserve area is a part of the property set aside in the event that the current drain field fails. Protect your drain field from motor vehicle traffic, parked vehicles, heavy loads, and livestock. Don't dig, use heavy fertilizer or weed killer on your drain field. Also, be sure not to build anything over your drain field. Protect your drain field by diverting surface or roof water runoff away from it. Look for shallow root plants. Contact your local nursery or health department for more information about what's safe to plant over septic systems. This tree was planted in a below-grade sand filter. The tree roots completely filled all the pipes in the sand filter, and it had to be replaced. Your septic system requires routine maintenance. This includes inspection of all system components, pumping tanks, and cleaning filters when needed, and making sure repairs are performed. Risers increase accessibility to the system for you or a professional. They can also keep costs lower if a professional needs to service the system. If you do not have risers, you should have them installed.
Perfect. All right, we're going to go into our next topic, record drawings and/or as-builts. So record drawings or as-builts, these guys are a key to locate your underground system. We're going to look into where to find your record drawings, and we're also going to learn kind of how to interpret and use your record drawings when you're on your site. Next slide. So we're going to kind of go first into how to find your septic system records. So the link right here will take you directly to our document search page on our website. From here, you can either you can try several different methods of search. You can search by parcel, you can search by address. If you're searching by your address, we always recommend trying to do your house number and then your street number. Oftentimes, the less information you give to the system, sometimes it produces more documents for you, right? Depending on how we save them throughout the years. You can also search by your owner name or a past owner name if you happen to have that on file. The instructions are there on the website to kind of follow along to be able to search. If nothing is pulling up and you're not able to find any record drawings, we do have that little blue button on there that you can submit a public records request, and you'll fill out all the information, send it to us, and then we will do our work on our end to see if we can dig something up. Oftentimes we have different tools that we can use to be able to source something down. Keep in mind that some older septic systems were installed when record drawings weren't necessarily a requirement by the health department. So oftentimes there won't be a record drawing on file for those older systems, but your septic company can help to locate your septic system if you would like to have that done. That does come at a cost. So always just keep that in mind if you're thinking about doing that. Next slide. All right, record drawings, older versus our more modern ones. So the first thing, we search for our record, we're able to have it, we pull it up, and what do we do with it, right? That's like most people's first question. What do we do with this record drawing? You're gonna wanna orient yourself with that north arrow. So find the north arrow on your as-built or your record drawing. Both of these drawings do have a north arrow. The one on the left is gonna be from the 80s, 1980s-ish. And then the one on the right-hand side is going to be your more modern drawing, which is more of our today's standards of drawings, and that's from about 2024. So both have north arrows, which is fantastic. You can use the scale on the map. The 2024 drawing does have a scale on there to help approximate distance when you're on the ground. You're going to want to locate all your components. So that would include your tank. If you have a pump to gravity system, that would include your pump tank, your D-box, and your drain fill lateral lines. These are really necessary for inspection, repairs, just routine maintenance. It's good to know where your stuff is, all your components are, so that way you're not driving over them, building over them, planting over them, etc. Right? Like I said, older plans were hand-drawn, as the 1981 clearly detects. But you can still pretty much see where everything is at. Just look for those pinpoints on there where the house is. Sometimes they'll have a driveway to kind of indicate, okay, where does everything start, if there's not more indicating factors to be able to help you. So the drawing on your left, we're actually going to look at both of them. The drawing on your left, you can see where it has the house. The first tank in the series is going to be your septic tank. The second tank in the series that has the circle in the middle is going to be your pump tank. So this is a pump to gravity system that we're looking at right now. From there, the effluent goes right into the D box, which is this really tiny little square box. From there, your drain field lateral lines are connected to that D box, and the effluent flows out into your drain field lateral lines. So again, pump to gravity system is on the left. Now on your right-hand side, this is going to be a standard gravity system. So you have the first in series is going to be your septic tank. From there, you go out to the D box. And then again, connected to that D box is going to be your drain field lateral lines, and that's where the effluent finishes its final treatment. On the very, very end, you can probably see those tiny little black dots on the 2024 drawing, the newer drawing. Those are called inspection ports. And what those do is on most of our newer systems, they can be installed in our older systems as well, but those actually gain access, easier access to the drain field lateral lines. So let's say you have a clogged drain field lateral line. Most septic systems don't have these inspection ports, especially your older ones, right? So what they have to do is they either have to go through the tank or the pump tank to be able to get out to those drain field lateral lines. With these inspection ports, they don't have to do that. It's easy access. They get in, they clear out the clog, everyone's happy, yay, we can move forward, right? So that's what those are. You can, like I said, you can install them on older systems. It does come at a cost though. Next slide. Finding septic system inspection and pumping reports. So you can visit onlinerme.com/TPCHD. This link right here will take you directly to the search page with Pierce County already selected. You can even look at other counties as well and see if you're looking at a house in another county, you can pull up inspection reports from them as well. You can enter the address or the parcel number and then hit search. I always recommend people to go back, especially if they're new homeowners to a new house, go look at the history of what the septic system has been through. Has it been maintained on a more regular basis? Have there been any repairs, pumpings, inspections, etc.? It's always great to go back and look at the history of the septic system and the life that it's lived so far. Next slide. Best practices. So what to avoid? Garbage disposals on septic systems. Don't pour chemicals down the drain. Avoid any products with caution, warning, or danger. And avoid cooking oils, fats, and greases. Next slide. We also want to conserve our water. So break up those household chores that use water. So limit the number of laundry loads per day, run the dishwasher, the clothes washer, and even the shower at different times. I even do this and I'm on sewer, so it's always a good practice. And then fix your drips. A leaking faucet can waste 5 to 20 gallons per day, whereas a leaking toilet can waste up to 4,000 gallons per day. And yes, that seems like a lot, but what does that have impact on your septic system? If you're overloading your septic system with water, it can cause a potential failure quicker. So just keep that in mind. You want to be using the gallons per day that it's sized for. Next slide. Protect your drain field. Avoid heavy objects over your drain field. Don't park or drive over your drain field. Heavy animals can compact the soil, and they can also damage the components. So just make sure you keep those clear. Keep full access to your septic tank. Don't build a deck over your septic tank. There's been many times where I've gone out to do a property sale inspection for a septic system. And I get there on the property and it's a deck, of course, on top of the septic tank, right? A lot of homeowners are very smart and they will build a latch system so they can pull up their deck. And then there's easy access for us and the septic professionals to be able to get to that. So we just want to make sure we can get to all the components in case there's an emergency happening, right? Next slide. Be mindful of what you flush. Only flush human waste and toilet paper down the toilet. Please do not flush wipes, even if they say they're flushable. I promise you they're not, and this goes for sewer as well. No drugs or medication down the drain. Use a local medicine return and collection program, and we do have information about that here on our website. Your system also may require more frequent pumping and or maintenance if someone is on chemotherapy or long-term antibiotics. Next slide. And why would it need more pumping or maintenance if someone's been on chemotherapy or long-term antibiotics? Is because in our septic system, we have what's called a microbiome, right? It's more sciencey talk real quick, but your septic tank is full of microorganisms and or what we like to call them bacteria, right? These little guys help to break down waste to help prevent the solids from going out into the drain field and from building up into your tank. So we usually say when it comes to, think about household cleaners, right? Disinfectants that we spray on our countertops. We want to use them to get rid of bacteria. Same thing if you're pouring too much down your toilet, down your drains, into your septic system, it could actually kill off that microbiome, those organisms that are helping to break down those solids, right? So we just want to keep them happy and clear. We don't say you can't use cleaners or additives. We always just recommend using what it's designed for. Use the dosage that's correct, right? Don't overuse them. Next slide. All right, get our hands ready. Here we go. A leaking household fixture can cause harm to your septic system if not addressed. True or false? How many chose true? And false? I hope no one chose false. Good job, 100%. All right, next slide. So what should you do before a septic inspection? Get a record drawing of your septic system if there's one available. Call a septic professional to inspect your septic system every 5 years if you are part of this program and have been approved. We do have a certified professional list on our website, so you're more than welcome to look into that. Locate your system components and uncover tank lids for the septic professional. You can do that. You can also let the septic professional do that as well. They have to pull up your record drawing anyways before they come out on site. If they do uncover your lids, usually that, and they have to dig to them, usually that does cost something. So just always keep that in mind if you're trying to save some money, maybe dig them up yourself or have a friend do it. Review your water usage and then just maintain those records. Look up the inspection reports, know what's going on with your septic system, especially after you just had a professional go out there, look at the report that they submit just after your inspection. Next slide. So what should the septic professional do when they come out on site? They're going to inspect the septic tank, right? They're going to inspect the pump tank and the pump if you have a pump to gravity system. They're going to pump the tanks if needed. So they'll measure your scum and sludge level and make sure they're in good operation levels. And then they're also going to check the drain field area. So they're going to walk your drain field area, make sure there's no ponding in the area, make sure there's no squishy soil or a smell coming from your drain field. That's what they're going to really look out for. Next slide. All right, things to watch out for. Secure your lids. Cover your tank openings with durable lids you can secure in place. Check for damages and cracks. Plastic lids should be securely screwed into the risers, and then install a secondary safety device. Next slide. Perfect. And what is a secondary safety device, you might ask? It helps protect against unauthorized access to septic tanks. It protects against accidental falls into septic tanks. And here at the health department, we do have financial assistance that can be offered to go towards and cover some of the cost for a secondary safety device to be installed. Next slide. Tank problems. Missing or broken baffles. So the inlet baffle, that assists with separation of liquids and solids as the wastewater is going into your tank. The outlet baffle prevents solids from entering into the drain fill lateral lines. And that usually, if solids enter into our drain fill lateral lines, that's where you start to see clogging happening in your drain field over time. Leaking tank. Low liquid levels could mean a cracked or leaking tank. So you always want to make sure that your system is at operational levels. Next slide. Electrical problems, pump malfunctions. So only septic professionals or electricians should repair or replace. An alarm malfunction, an alarm should usually sound when the water levels are high in a pump tank. Gravity systems might not have pumps or alarms. I also advise with a pump to gravity system, alarms weren't really required until about 1982 in our county. So your pump to gravity system might not have one on. Doesn't mean it can't have one installed. So something to think about if you know you don't have an alarm on your system. I always recommend just kind of thinking about it. It helps just protect to make sure, again, your system is in operational levels. And then call a professional. Don't mess with your control panel if you have one. Some newer systems don't have panels, or do have panels like this one, excuse me. If you have an alarm going off from your panel, you might be able to usually silence that alarm. But then again, you can silence it, but call a septic professional to come out and see kind of what's going on with that panel. Next slide. So here is a great image of what your drain field should look like. Mainly grass is what we usually recommend over your drain field. We don't recommend bushes, vegetable gardens, none of that. Just keep it grass. And a cute little cat in the background, if you can see that. It's always awesome. And then next slide. And then what your drain field should not look like, right? We shouldn't have blackberries over our drain field. Blackberries, oftentimes when they get really, really large, usually those roots are huge, right? We don't want roots to get into any components of our septic system, actually. And then that also, the other image is just ponding over a drain field. We do not want to see that in your drain field either. Next slide. All right, next question. What are signs of potential failing septic system? Choose all that apply. A, dry drain field when there's no rain or irrigation. B, sewage backing up into the home. C, low levels in the septic tank. D, dead vegetation or brown area over the drain field. How many of us chose A? I can feel the tension. B, C, or D? Okay, next slide. The correct answers are B, C, and D. Good job, everyone. I'm impressed. All right, next slide. Thank you. The cost of poor maintenance. All right, proper septic system care and maintenance. These help to find issues before your septic system fails. Helps save money and protects your investment, protects your family and the environment around you, and it also helps to protect property occupants from potential injury or death. Next slide. So some cost estimates. Like Laurel said, the most affordable septic system that you have is the one you have right now. A new septic system could cost $40,000 or more. So, and the cost of regular maintenance, inspection costs between that $200 to $300 range, where a pumping can cost anywhere between $400 and $600. And we always usually tell folks when we're on the phone with them or emailing them, call a couple different companies, right? Every company is going to be a little bit different in their pricing and how they operate. So we always tell folks, call around, see what different quotes you can get from different companies. Financial assistance. So like I mentioned earlier, we do have a financial assistance program here at the health department. So for routine inspections, we offer a $125 discount. Tank pumpings, we offer a $200 discount. Riser installation is a $125 discount. And then minor repairs is up to $500 discount. And like I said, those secondary safety devices can be included underneath that minor repair money that we can get. Some of the program features is that the company is the one that actually provides the discount at the time for the customer. And then we as the health department reimburse that company. It's just a little bit easier, take a little stress off of that homeowner. I do want to highlight one thing is that we do work really closely with a couple different entities like Pierce County, Cascade Water Alliance, and the Puget Sound Partnership. These entities help to provide this program to the public. So I really just want to stress how important those relationships are to be able to give this resource to homeowners to be able to afford this requirement. Next slide. All right. What is required to maintain my gravity or pump to gravity septic O&M? A, get my septic system inspected every 5 years. B, fix any issues with my septic system immediately. C, plant trees with deep roots over the drain field. Or D, keep my septic system in sanitary condition. All right, by a show of hands, how many chose A? B? C? Good job. D? All right, next slide. A, B, and D. Don't plant trees over your drain field, please. All right, and congratulations and thank you. The next steps I would tell homeowners is that I would email them with documentation on how to apply for this program, and then all the septic related links that we have throughout our PowerPoint. So thank you all so much.
Thank you. Are there any questions? I feel like I'm getting feedback. Board Member Olson.
I had a couple, probably personal. I'm curious about the inlet baffle and the outlet baffle.
Yeah.
And my outlet baffle, I'm pretty sure that's the sock filter, right? That big three.
Usually that's what the one that has the filter
Yeah.
on it, yes.
So am I supposed to change that more frequently or just wait for my septic to be pumped every?
You can. We usually recommend them just to be cleaned at your septic, and when the company comes out for their inspection, we usually just recommend them to be cleaned.
Yeah. And
Yeah.
is there an inlet baffle somewhere that I should know about? I've never checked for my inlet baffle. Like,
Yeah, your inlet baffle is going to be connected to the transport line from like the house into the tank, so it's going to be on the opposite end of your outlet baffle, essentially.
Well, that's something to look forward to.
Yeah.
And I'm curious, is it an urban legend or not about antimicrobial hand soap? I've always heard that, oh, these hand soaps, they're all antimicrobial and they're messing up all these septic systems. But maybe that's my dad. I don't know.
It might be. But what I will say is, as long as you're using the designated amount, right? What is suggested, you're not going to mess anything up. It's when you start to over pour, like if you're over pouring bleach, you're using bleach everywhere. That's where we get a little cautious, right? You want to protect it, but using that hand soap is totally fine.
Okay. And my last thing, I clicked on the links and they worked great. I was able to find my as-built and all that kind of stuff.
Yay.
But I went off, right off my PowerPoint presentation. Are they really easy to find for somebody on the website?
Yes, they really are. And like I said, I usually tell folks, if you don't have a computer, come up to me at the end of class. We'll look at your as-built, we'll look at your records, we'll make sure everything looks good. So usually we can do that at the time, especially folks that maybe don't have internet access or computers. They're coming in person, right, for this class. We provide all those resources at the end, and we stay longer to make sure that they're fully equipped before they leave.
Okay, thank you.
Thank you. Any additional questions? So it sounds like Board Member Olson actually has a septic system. I don't. You do? Okay. Good to know. How about you?
I used to.
Yeah.
Okay, I grew up with one and
Same.
always was amused by how pretty the grass was over the drain field and how
Yep.
dead the grass was over where the septic tank was, which is why I got that question wrong. I didn't read it correctly. But anyways, okay, I'm not seeing any other questions, so thank you very much. Appreciate it.
Thank you.
So our final presentation, which also involves maybe not a test, but a tour, we're going to go and visit the public health clinic, but we're going to do an introduction here in Chambers.
Good afternoon, Chair Hitchin, members of the board. I'm Melanie Lopez, the Division Director for Strengthening Families, the division under which our public health clinic sits. Thank you for joining us today. So today we're going to be sharing a very brief presentation on our integrated public health clinic. And then at the end, we'll take a tour and walk through the clinic to get the full picture. Next slide. So we've linked a couple of the measures from our strategic initiative and our strategic plan, of which we're measuring the reduction of deaths from opioid use disorder among Pierce County residents, as well as strengthening our OUD treatment services program, as well as reducing new cases of HIV and eliminating various STIs in Pierce County by 2029. So currently, our public health clinic provides the following services. We're providing STI and HIV testing and STI treatment. We're also providing opioid use disorder treatment, and that includes both medications and counseling. Under the public health clinic as well, we have our street medicine program, which you heard about probably recently, addressing urgent and primary care services for people experiencing homelessness. So previously, these were siloed and they were in different divisions and locations within the health department. And you'll see some of the areas downstairs when we go take a tour. Next slide. So why clinic integration? really in order to combine our opioid use disorder and STI and clinical functions in the same space. We also are now, because of the integration, able to offer daily walk-in services for HIV and STI testing. We also wanted to be able to provide a continuity of care and access to different services. Originally, the clinic was just our opioid use disorder facility. And also, programs are sharing resources and systems to increase efficiency. So now we have, we're seeing a lot of close collaboration and workflows between our street medicine team and our STI, for example, and STI and our opioid treatment program as well. So being able to share some of the skills that our staff have and be able to cross over into the different areas has been really helpful for our integration as well. Next slide. So when we go down to the garden suite, here are the things that you'll be seeing. So our first floor, we have expanded our lobby area. The check-in area now has space for both our front office and our billing staff. So people, when they first arrive, go to that check-in desk and fill out their check-in, fill out any intake forms, and that's in one central location. You'll also see a nursing station within the clinic, and this is a co-location for all of our nursing staff to help improve teamwork and communication as well. And we also have new signage, and you'll also see when we go through a badge door that really helps create a designated clinical space within the health department as well. So some of our future direction, we are thinking of expansion and increasing our reach within Pierce County. So additional services that we're discussing right now, we'd love to be able to provide immunizations to the public. Also HIV PrEP, family planning services, hepatitis C treatment. So we are in discovery mode for our health hub locations, and this really is informed by what the community needs and has expressed in terms of health services. Next slide. So now, that was a very short presentation. I would like to invite the board to join Director Reed, our Division Director Andy Rohr, and myself on a tour of the public health clinic.
Okay, so we just get up and go, or do I put us in recess? Okay, that makes more sense. Okay, that's what I thought. Okay, so we are going to move into recess until we conclude the tour, and there is no anticipated business after that. Again, it's a study session other than adjournment, so we are in recess. Is it still recording? Okay, so I can go? Okay. Good afternoon. The time is 4:35. We are back from our recess, and at this time, there is no other business before the Board of Health and Study session, so we are adjourned. The time again is 4:35. Thank you.